Hello. This presentation is intended for the dental assisting student. This slide presentation is about BITEWING radiographs and images, and we're also going to look at the basic armamentarium for obtaining BITEWING radiographs/images. These types of images are also known as a BITEWING series, a BITEWING survey, and in some textbooks they also call it the BITEWING examination. In many dental offices, they simply refer to this particular type of image by the number of images taken. So they may say 2 BITEWINGs or 4 BITEWINGs, which is a typical series. So here is a set of BITEWING images or a BITEWING series, and I want you to take a few seconds to look at it and think about what do you see. So you want to recall some of your dental anatomy. Also, you want to think about what are the indications for a BITEWING X-ray series. So let's look at what we have here. We have images of molars. This would be the patient's right side. So images of molars from the maxillary and the mandibular. You can also see pulp chambers. You can see the bone level in this image. And then the next image, going from the patient's posterior right, moving a little more mesial, we have premolars. And we can see much of the same dental anatomy in this particular image that we did in the molar image. Crossing the midline, we have the patient's left side for a premolar image, and you can see both the maxillary and mandibular premolars and all of the same anatomy. And then we have a molar BITEWING image for the left side, and again we see much of the same anatomy, and this patient actually has some amalgam restorations that appear very white or radiopaque in the X-ray image or radiograph. So what are the indications for a BITEWING series? Well, these BITEWINGs, when they are of diagnostic quality, are very helpful to the dentist in diagnosing any caries in the interproximal or area or at the proximal surface of the teeth. And also the dentist can see the level of the bone, so the health of the bone of the patient. For the molar BITEWING and the premolar BITEWING. These are horizontal BITEWINGs, so they're taken kind of with the widest part or the length here. There are vertical BITEWINGs that will be covered in another slide presentation. We're going to focus on horizontal BITEWINGs. Next, we have some of the armamentarium. So first we need to have a dental radiography unit. This is where X-rays are actually produced, and by our expertise, we are going to then have radiographic images, but we need to have a dental X-ray unit, and this is a wall-mounted unit. Then we need to have some kind of image receptor. So this is a digital sensor. Then you will need to have a computer program in order to see the images. And this is really the state of the art. This is current technology that's used in dental practices. Then you might run into the traditional film, and this is very much like the old-fashioned film with a camera. So we would have our dental X-ray unit. There's actually film inside these little packets in which we have to develop them, much like the old-fashioned photographs, in chemicals in order to have an image. So those are the two that as a student you might be using in your dental assisting program. Now let's look at a particular area on the dental X-ray unit. It's part of the tube housing and it's called the PID, the Positioning Indicator Device. And this PID is like the lens of an old-fashioned camera in that you need to focus it and position it in just the right position to get a clear diagnostic image. And this is just another style of PIDs. They come in different lengths. They can be square instead of a round PID. And the actual particulars of the equipment will also be covered in another slide presentation. There are different types of image receptors. There is the very popular digital sensor, the old-fashioned but still very useful dental film, and then another indirect digital method called the photostimulable phosphor plate, or a PSP plate. So let's take a look at those particular types of image receptors. So the very popular digital sensor, this is just one brand, happens to be the one that I use in the dental assisting program where I teach. And so you can see some plastic. This is a barrier for infection control, so you don't get saliva all over your sensors and have to keep putting chemical disinfecting, because you cannot sterilize these sensors. And this is a little BITEWING tab that will help to hold the sensor in place, and then the patient actually bites down, and this is one type of technique for obtaining a BITEWING image. And then we have different size sensors. We have a number 2, which is kind of your normal or average or regular size that we use. And then there's a number 1, which could be used for pediatrics. Here is our traditional film. So if you look over at some examples of film, what size film was used for our BITEWING radiographs that we saw? If you're saying a number 2, you are correct. A number 2 size film. And these films have been given these sizes by the industry. And so there's a smaller one, a number 1 that could be used in pediatrics, a 0, which you can see is much smaller, definitely used in pediatrics. And then there's kind of an rectangular shape, number 3. My experience is I've seen this mostly in the military dental clinics, where they would take one image on each side, and you can actually get the molars and the premolars. You might wonder why it's not used more often, because it certainly would reduce the exposure to the patient. Sometimes it's difficult to get a diagnostic quality, like open contacts. I mean, it can be done. You know, we are striving to be the experts here in obtaining radiographic images, so it just takes some practice. And then with film, you have a bite tab. You place it in the patient's mouth in a particular area and position, aligning the PID in a proper position, and you would have a diagnostic quality BITEWING radiograph. Then we have the photostimulable phosphor plate, also known as the PSP plate. And the PSP plate is actually an indirect digital system. So you have something that looks like a film, but it can be reused. And it's placed in a barrier envelope or a little packet and sealed so that no saliva affects the plate. And then once the plate is exposed with our PID and the X-ray unit, then it is scanned. So each type of PSP plate systems have their own scanners. This is kind of a very popular one. And then when it's scanned, it is then sent to it talks to a computer with a program set up for phosphor plates, and then you have a digital image for your radiographs, for your images. So this is the phosphor plates. Other armamentarium that would be used to obtain a BITEWING image might be an extension cone paralleling device. This is just one type that's on the market. And you have a rod and a bite block and a ring. And if this is aligned properly and placed in the mouth properly, the PID, then this ring is on the extraoral, it's on the outside of the face, and so you use the ring to align the PID. And most of the time, I would say about 90–95% of the time, this works very well for a diagnostic quality. Sometimes if the patient's teeth are not in perfect alignment, maybe their facial features, they're not like textbook, so sometimes you might have to set your PID, what we call, off the ring in order to get that diagnostic quality image. Or a tab might be used. Now, when you use a tab, we say that we're using a bisecting technique. And the bisecting technique, you really have to have a good understanding of the position of the image receptor to the patient's teeth, and then the PID to the facial landmark and the alignment, which we'll look at in another slide presentation, of the image receptor, the teeth, to the PID. So you don't really have, like the paralleling technique, you don't have any kind of an indication as to where you should place the PID. In a bisecting technique, you have an indication, it's facial landmarks, but it takes a little critical eye and some experience to get a quality BITEWING X-ray. It is doable. Even if you're a student, though, you're able to do both techniques. They have some similar holders for film. So this is another type of paralleling technique device, an XCP. You have a rod and a bite block and a ring. And then also for film, you could have a BITEWING tab, either a loop that you place over the film or an adhesive type tab, or this is a little sponge with adhesive. And so this would also utilize that bisecting technique. When you're learning, when you're a dental assisting student, whether you are in a school or a program or in a workshop, we learn on what's called a Dexter. And this is made by Dentsply Sharona. They're pretty standard. It's actually a real skull with real teeth and a lever to close their mouth. And so they're very cooperative. They don't have saliva. They do have a big rubber tongue that sometimes you have to kind of push it out of the way. And they don't mind being irradiated. So you can practice with other course safety protocols on Dexter and get really good and be an expert before you work on a patient. That concludes the introduction to the BITEWING series, radiographic images, and the armamentarium that is used to obtain those images. Thank you for listening, and please look further for slide presentations. Thank you very much.